How does an oncologist interpret brain tumor diagnostic results? Imagine trying to solve a complex puzzle where each piece reveals part of a bigger picture. That's exactly what an oncologist does when interpreting brain tumor diagnostic results. They start by carefully examining detailed images of the brain, primarily using magnetic resonance imaging, which provides high-resolution pictures showing the tumor's size, shape, and exact location. These images help identify how close the tumor is to critical areas controlling speech, movement, or other vital functions. Advanced MRI techniques like functional MRI can map brain activity, helping doctors plan treatments that avoid damaging important regions. Diffusion tensor imaging shows white matter pathways, revealing how the tumor might be infiltrating surrounding tissue. Magnetic resonance spectroscopy looks at the tumor's chemical makeup, giving clues about its type and activity. Perfusion MRI measures blood flow within the tumor, which can indicate how aggressive it might be. Sometimes, a computed tomography scan is used, especially if a quick assessment is needed or if the patient has symptoms like sudden neurological changes. PET scans can also be helpful by showing how metabolically active the tumor is, giving insight into its growth potential and whether it might have spread beyond the brain. To check for possible spread beyond the brain, doctors may analyze cerebrospinal fluid through a lumbar puncture, looking for tumor cells or markers that suggest metastasis. However, imaging alone isn't enough for a definitive diagnosis. The oncologist relies heavily on tissue samples obtained through biopsy or surgery. Under the microscope, pathologists examine the tumor's cellular features to determine its type, such as glioma or meningioma, and its grade, which indicates how aggressive it is. Molecular testing can reveal specific genetic markers that influence prognosis and treatment options. The doctor combines all this information, imaging results, tissue analysis, clinical symptoms, and physical exams to form a clear picture of the tumor. They also consider other scans, like chest or abdominal imaging, if they suspect the tumor might have spread from elsewhere. Sometimes, treatment effects can mimic tumor growth on scans, a phenomenon called pseudoprogression, so the oncologist uses additional imaging techniques and clinical judgment to distinguish between true progression and treatment-related changes. In essence, interpreting brain tumor results involves a detailed, multi-step process that integrates advanced imaging, tissue analysis, and clinical insights. This comprehensive approach helps the oncologist develop a personalized treatment plan aimed at controlling the tumor while preserving as much brain function as possible. It also provides vital information about the likely course of the disease and helps monitor for recurrence or response to therapy. Throughout this process, the oncologist follows established medical guidelines and relies on current scientific evidence to ensure the most accurate diagnosis and best possible care. Remember, every patient is unique, so personalized medical advice from healthcare professionals is always essential.